Hi, I'm Dr. Donna Marchand. I'm the program director for the cardiology program here at North Shore University Hospital and Long Island Jewish Medical Center.
Northwell Health is a large academic healthcare system, actually the largest in the region. We have 21 acute care hospitals, 5 of which are tertiary hospitals. The beauty of cardiology at Northwell Health is cardiology is in each and every corner of our system.
Fellows get experience to all kinds of patients in both campuses.
North Shore University Hospital is our quaternary care hospital for cardiovascular disease. It's where we do the most complex care, including mechanical circulatory assist, cardiac transplant, structural heart disease.
Long Island Jewish Medical Center is the second largest hospital in the Northwell Health System. Given the fact with its proximity to both Nassau and Queens, our fellows are exposed to a very diverse patient population here. Long Island Jewish Medical Center is the oncology and OB center in our health system, allowing our fellows to be part of a very integrated team in managing complex patients.
This gives them a broad exposure not only to the diversity of patients, but also diversity of pathology.
It helps you build a larger repertoire of just like tools and tricks of the trade that you can use to help your patients down the road and to know when to ask for help.
I feel like people outside of New York, they don't really realize how huge Northwell is.
We take care of about 25% of the entire state of New York in terms of the cardiovascular needs.
With the power of the health system, we see a tremendous amount of volume. We do about 8,000 angioplasties in our health system, and we do about 3,200 here at North Shore. We do about 400 TAVRs a year here, 50 transplants a year, and we know with volume and quantity you get quality.
I wanted to see a lot of volume so I can become better at things and more comfortable with different pathology.
We have cardiology, we have cardioobstetrics, we have a very robust vascular cardiology rotation embedded into our fellow curriculum as well.
We see a variety of pathology that you don't see just anywhere else.
I think that the acuity and the breadth of disease that you're going to see here is not something that you're going to get most places. Of the 12 beds we have now, I would say at least 3/4 are on some form of life support. I sort of prioritize education for the fellows when they're there. I'd like them to sort of grow into the role of junior attendings, but to do that, I think sort of learning comes first. How to take care of not just sick hearts, but sick patients with sick hearts.
They really care about your education, they care about you becoming a better cardiologist, and more importantly, they care about you as a person.
Starting off as a new fellow on day one, the attendees come over and introduce themselves by their first name. So it's sort of an environment where there's collaboration and you're seen as a colleague.
Our program director, Dr. Marchand, and our chief fellows and things like that, they really kind of help us grow into our own and decide what we want to do in cardiology.
I think they set very high expectations for us as fellows, which I think helps us grow. And there's autonomy that's given as needed.
I think it's a great environment to learn, great environment to train, great environment to practice.
We're in the midst of opening up a new pavilion, which will have 18 new operating rooms, 5 of which are cardiac, 3 new hybrid rooms for which we can participate in really any type of hybrid procedure, a brand new 44-bed unit, integrated cardiovascular intensive care unit.
As we transition to this new building, the hope is that we'll also start taking care of ECMO patients.
From an imaging standpoint, we provide very comprehensive advanced echo imaging, from contrast to strain imaging, 3-dimensional echo. We have enough volume for transesophageal echo. We'll have advanced techniques here in terms of nuclear imaging as well as CT and MRI. We hope to have cardiac PET within the next couple of years, and hopefully that exposure will provide a very good introduction to advanced cardiovascular imaging.
This year we had 754 applicants. We interview about 145 applicants for the 9 spots.
One of the major benefits of this program is it's so front-loaded, so that in the last few years of your fellowship you can really get kind of an individualized approach to whatever you want to learn. So for me, that was spending the last essentially year in the EP lab, working closely with the attendings that I was going to be applying to fellowship with and now working with as an EP fellow.
Northwell Health is an academic healthcare system.
We have a fellow research faculty member that meets with each of the fellows and helps to match them with their interests.
We have a very supportive environment for research projects. Many of our attendings are actively working on things, whether it's database retrospective studies or actually industry-supported prospective studies.
Looking back in the last 3 years, I think the most important takeaway is the people.
There's really a great camaraderie. There's such good spirit amongst all the fellows, amongst the faculty.
We get along really well, and it's been a great experience working with them.
There's always someone that's helping you out, and you know, you're never alone.
My co-fellows, my year, the years below us, I think are some of the best people I've ever met in my life, the hardest working people I've ever met in my life. And I'm very lucky I was able to meet them.
I don't think I've had a bad experience ever, like picking up the phone in the middle of the night and calling and attending and asking their opinion or running something by them.
There was always someone on the other line to help me out.
I mean, in general, I think it's really important to have fellows who really want to be here. It makes it a very positive experience for everyone, and people who are happy learn much better than people who are not happy.
I live about 20 minutes south of here.
I live in Astoria, Queens. My commute is not too bad, so usually when we have to be here around 7:45, it's about a half an hour drive.
I actually lived on Long Island as well my first 2 years.
The availability of things to do, the food, oh my god, is fantastic.
It's really nice because on the east side you get the vineyards and the beaches.
It definitely makes working hard in the hospital much easier when you get to enjoy the city and the amenities.
It's also important to make sure that there's a good work-life balance, and that's always possible, particularly in this program.
I still do a lot of stuff outside of work, involved in several leagues, play different sports and things like that. I stay active and, hang out with my friends and family. So, there's still a lot of time to kind of do what you want to do.
We all go into this field looking to be the best cardiologist we could be, perform, do research, always be the most fantastic clinician you could be, but outside of that you have a life, and I think this program takes that very seriously.
I have 2 kids. I have a 2.5-year-old and a 6-month-old.
As soon as I told them that my wife was pregnant and this is our due date, it was kind of like, what can we do for you to help make this better?
Whether it's like a religious reason or something within your personal life that pops up, doctor's appointments, everybody's very accommodating.
I still feel like I'm up to date in my training and also have a wonderful family to go home to in the end of the day.
On a personal note, the best part of my day is sort of teaching. I always enjoy having fellows around, and I enjoy watching them sort of grow and trying to take the lead, taking care of people.
I can safely say that when they leave the fellowship, they are extremely well trained and ready to pursue anything in the future.
You can get great education everywhere, but there are very few places where you can get great education and feel like you belong.
Our fellows are really front and center with everything that we do here, whether it's patient care, education, training, teaching. It's really a fellow-centric program, which is, I think, the essence of who we are here